understanding assisted living and in-home nursing care. What questions should you ask when looking for in-home healthcare services? Joyce Elliott, founder and CEO of Angel Care Private Duty Nursing Services, explains.
The first thing is the company licensed through the Board of Health in Richmond? You want to make sure that they are board licensed. Secondly, do they have insurance, general liability insurance? Are their employees bonded? Do they have workers' comp insurance? Where their office is located? A lot of people don't realize that in order to be state certified in Virginia, you have to have your agency in a business setting. It cannot be run out of your home or your garage or anything like that. Okay. And what level of care do you offer? Do you offer companion sitters? That means that they cannot physically touch the patient in the state regulations. A personal care aide, which is considered a PCA, what's their level of expertise? Are they a certified nurse's aide? Are they an LPN? Are they an RN? Make sure that they have all those different disciplines to deal with whatever your family needs are.
What are some common misconceptions people have about private duty nursing?
A lot of people have a misconception that private duty is just coming in and sitting with mom or dad, whatever the situation. We look at, can they take care of their activities of daily living? That means, can they help groom themselves, or do they groom themselves by themselves? Do they do their housekeeping? Can they still cook? Do they go to the grocery store? Are they still driving? Do they have to hire an outside company to take them to and from their doctor's appointments or their hair appointments? So all the little things that you and I would normally do every day, jump in our car and run, a lot of the elders can't do that, so they need that extra support.
Tell us more about Angel Care Private Duty Nursing.
It's privately owned. It's my personal company. So we don't have corporate America telling us to make our decisions and how to do that. We have a clean record with the State Board of Health. We had no deficiencies on our last survey. They come in every 2 years to do an unannounced. That means they can walk in the door anytime they choose within that 2-year period. Unless there's a complaint. If an employee or a family or a patient or anybody contacts the certifications of licensure in Richmond, then they would come in unannounced to do an inspection. So there's a difference in a survey and an inspection. We're very personalized with our clients, very flexible. We look at each individual case to see what their needs are and how we can streamline their care to give them the most services that we possibly can to keep them as safe as possible in their home.
Who pays when it comes to private duty nursing?
It is not paid for by any insurances unless it's a long-term care policy, and that's a special policy that you can take out with a long-term care specialist. Your Medicare does not cover our services. However, if we do go into the home and we find that a patient needs what they consider a skilled service, physical therapy, occupational therapy, and those types of nursing needs, then we can contact the agencies in the area to help you get those services. All those are paid for by your insurances. Our services are private pay or long-term care reimbursed.
Besides nursing care, what other services does Angel Care offer?
And we also offer just a division of domestic services, where even though you don't have the clinical need for the nursing services, we can offer the domestic side where we can send somebody in to help you with your domestic chores. Light housekeeping, that would be running the vacuum, dusting furniture. It can entail some of your laundry, cleaning the kitchens and the bathrooms. We do not do chandeliers, windows, and all that. That's a whole nother company that can take care of those needs. We can help with errands, grocery shopping, beauty or barber shop visits, doctor's appointments, anything that you may not be able to drive yourself, then we can take care of those needs.
What about post-surgical care?
We do work with several of the plastic surgeons in the area to where if you decided that you wanted to have any type of elective surgeries, cosmetic surgeries, then we can come pick you up from the doctor's office after you come out of recovery, take you home or to your hotel or wherever you're staying, and then we stay with you per the doctor's request. That would be anywhere between 12 and 48 hours to make sure that your dressings are intact, there's no signs of infection, there's no problems coming out of the anesthesia, or any problems with your pain medications.
Who usually hires private duty nurses?
In some cases, it's the seniors themselves. There's a lot of alert and oriented seniors out there that know what they want. They want to stay at home. They're not going anywhere, and their heels are dug. So we go in there and make sure they stay as safe as possible in their own surroundings. We do have a lot of siblings. The children have stepped up to the plate. Mom or dad may be in a health critical situation where they can't make those decisions for their own, so the children will step up and call us on those. We do deal with out-of-state families as well. The families live out of state, but the parents may still live here in Virginia. They'll call and contact us long distance.